If we think you have PCOS, we look at the ovaries. But if we want to understand your PCOS, we look at the liver. Let me explain. When we are insulin resistant, we have more glucose in the bloodstream. The liver converts that into triglycerides that can build up in the liver as fatty deposits, a condition known as fatty liver called metabolic dysfunction associated steatoic liver disease. We see higher rates of this in PCOS. When this happens, we also see a worsening of testosterone symptoms. Sex hormone binding globulin is released from the liver, binds to testosterone, and makes it inactive. However, when the liver is resistant to insulin, it produces lower levels of sex hormone binding globulin, allowing for a greater portion of that testosterone to be free floating, contributing to symptoms like facial hair growth, acne, and hair loss. But also, we see an increase in visceral fat, the fat that is behind our abdominal muscles. The more visceral fat we have, the more free fatty acids that get leaked into the bloodstream that are stored as fatty deposits in the liver. The greater the amount of visceral fat, the more inflammation, which further worsens insulin resistance. We'll know if inflammation is an issue if the liver is releasing high levels of C-reactive protein. Send this to someone who would like this visual.